Welcome back. Winter illnesses are on the rise, and many parents are wondering what's going around and when to worry. This afternoon, Dr. R.W. Mills is here from Nationwide Children's Toledo to help families navigate the season. Big story today, welcome. Big story the last couple of days has been 2 elementary schools were shut down by illness. I think maybe a quarter of the student population was calling in sick with illness. What does that tell you?
Yeah, just like we're seeing in the office, I mean, we are slammed with sick kids, so lots and lots of flu. I know they don't like to close the schools. Obviously, we don't want to do that unless we have to, but once you get a certain number of kids that are absent, usually somewhere in the 25–30% range, which we saw in some of these local schools, it becomes an operational issue as well. Is it safe for the kids to come to school, not just from the illness standpoint, but sometimes your teachers are out, sometimes your nurses out, sometimes your bus drivers are out. So there's all sorts of operational issues as well. And so we try not to do that, obviously, in last resort.
What triggered it, you think?
Well,
is it seasonal?
Yeah, no doubt. The flu kind of has come in really, really strongly these last couple of weeks. Influenza A is the predominant strain that we're seeing. They've got a new substrain now this year that appears to be particularly bad. So the areas that have been hit around the world before us have shown that this is a particularly bad season, and just kind of hit in these last couple of weeks.
How do you differentiate one from the other? RSV, flu, pneumonia. How do you differentiate? Is it blood tests, or how do you know?
No, it's predominantly clinical, although we do have some tests in the office for things like COVID and for flu.
Nose swab, things like that you could do?
Absolutely, exactly. Yeah. These rapid tests that we've got now available. But there's definitely a difference between this in terms of the way RSV presents. RSV is kind of usually a general cold that comes on, a little sniffles and a little bit of a sore throat, a little bit of a cough, congestion, kind of gradually comes on. The classic for influenza is you get hit and bang, all of a sudden you're achy, you got a fever, you've got chills, your muscles ache, your joints ache. It's that abrupt onset, sore throat, cough, very, very different than the way RSV presents. And then the other one that you've heard about lately is this norovirus, which is a stomach virus, very different than RSV and flu. It hits with a big vomiting and then diarrhea, pretty intense, but doesn't have any of those respiratory symptoms.
Then they're all different in their own medical way. How do you attack them and get them to minimize the symptoms and get rid of it?
Yeah, I think predominantly the first thing we tell people about is prevention. So if you can get a flu vaccine, clearly it's not too late to get a flu vaccine, so we want you to do that. RSV, we have some really exciting stuff with RSV now. Pregnant women can get an RSV vaccine during certain times of the year, September through January, that actually passes antibodies and helps prevent the illness in babies. And we've got a shot for babies now, an injection, an antibody injection that actually blocks the binding sites for the RSV. And we can give that from day 1 of life all the way through the first 8 months of life. And when we look back in the last year, we just started it last year, it has been tremendously effective. So in the last year, when we look at the numbers now, we decreased hospitalizations for RSV, which is a significant problem for especially infants. 80% last year for babies that got the RSV antibody, or the moms got the vaccine. Decreased hospitalizations 80%, which is staggering, and ICU admissions for babies 95%. So we've got some really exciting stuff now that we can do to prevent these illnesses.
We have about a minute left here. During COVID, we developed some good habits. We all washed their hands diligently. We stayed a little bit apart. Now we've gotten back to how normal life should be. But I would think we'd still be doing pretty well about preventing some of these issues by washing our hands and being very diligent about that and cleaning surfaces.
Absolutely. And I think the big thing, that the teaching point is that in particular, we all use a lot of the hand sanitizers. Norovirus is unique. It is kind of resistant to the hand sanitizers. So for that specific virus, you have to use soap and water, good old-fashioned soap and water. RSV, influenza, the hand sanitizers still do a good job. And you're exactly right. Common sense, trying to stay away from those areas that are particularly crowded and going to events where there's lots of people that are sick, especially if you've got the young babies.
Vitamin C, vitamin D?
You know, I think good diet in general.
Yeah.
Sleep is very, very important. So getting your sleep and good nutrition in general. So if you're eating a regular balanced diet, I'm not saying that that stuff hurts, especially if you're eating a regular balanced diet, you probably don't need that. I'm sure it doesn't hurt though.
Doctor, we're here. It's that time of year. Thanks for coming in. Appreciate it.
My pleasure.
I enjoyed talking to you.